So what we've done here with this earlobe repair is remove a wedge here, just make an incision on each side of the slit earlobe that she had here. We've removed this wedge of tissue, and now we're going to close this slit that she has here. We're now sewing up the slit that she has here, placing, aligning the edges here of the skin, and then placing some deep sutures here to take tension off of the incision. So now I'm placing some small sutures here in the skin. These are absorbable sutures. They'll dissolve within the next week or two and create a nice scar in this region here. It's important for patients to clean this incision line twice a day with a little bit of peroxide, followed by a little bit of antibiotic ointment. We'll place a couple Band-Aids on each earlobe after this repair. As you can see, it's very well tolerated with a little bit of local anesthesia. It takes about 15 minutes in the office to get this done. This patient's on her lunch break.